Yeah.
All right, Katie Kelly, thank you so much for joining me. This is an important topic because C-section rates are on the rise, and we are working with more and more clients who had a C-section and are interested in knowing how to facilitate their recovery. So, I love to cover the specific topic of, what we can be doing for compression, abdominal compression after a C-section. And when I was asking around for who would be up to date on the literature here, your name was brought up right away. So thank you so much for agreeing to do this with me. And for the listeners that don't know Katie Kelly, will you tell us a little bit about yourself?
Sure. So, firstly, thanks for having me. I'm always excited to chat with someone else who has an interest in C section recovery. My name's Katie Kelly. I'm a pelvic floor physiotherapist. I've been a pelvic floor physiotherapist for almost 13 years now, I think. I work out of Moncton, New Brunswick on the east coast of Canada. I am co-owners with Erin Matheson in a multidisciplinary women's health pelvic health clinic called Reconnect Health Center. And aside from my clinical practice, I like to do research for fun because I'm a nerd. And I like to do some teaching. So C-section was a topic that was near and dear to my heart as I'm a twice over C-section mom. And I was a pelvic floor at the time of my deliveries and felt kind of lost. So I was very disheartened to think about what a woman in the general public would feel like if she was having to go through the same scenarios that I was going through. And so that piqued my interest to start researching more specifically in the C-section field. And that's what I've done. So I teach a course on C-section now.
That's awesome. Really quickly, for those that maybe don't know some of the numbers, like what are we looking at, like percentage of birth in Canada that are now C-sections?
Right. So our stats are falling somewhere between 29-30% of deliveries are via cesarean section. And if you're, a physio listening to this, if we're, comparing to like knee and hip surgeries, which we would see total knee replacements and hip replacements, 60,000, 70,000 of them annually in Canada. C-section is over 100,000. And so it's a very, very common surgery. It's the number one most common surgery in our country. And I think it's important for practitioners of all sorts to start gaining more familiarity with it because it is something that we're going to encounter in all of our practices, whether we are intentionally treating pelvic health patients or women's health patients or not.
Yeah, and I think that sometimes we don't think of it as being within our wheelhouse as physios to help support these people after C-section. I'm actually doing the next episode that's going to follow yours is with one of the local OBGYNs, and she's going to walk us through what it looks like to have a C-section, what happens in a C-section. So I think it'll be helpful for people to listen to that. But I actually come from acute care. So I worked in a large hospital before I got into private practice and specifically working with pre and postpartum moms quite often. But so I'm very familiar, and I'm sure most physios should be familiar with what that looks like to see people in the acute stage. I always say I would see people at very, let's say, scary times, like right after major traumas or right after brain surgery, open heart surgery. And we know the benefits of early mobilization and applying some of those principles of rest. Like we help people find the balance between rest and starting to mobilize. We know the importance of swelling management, compression, ice in those early stages. But can you speak a little bit to like, is any of this being transferred over to how we help moms after C-section? Like if you can kind of draw some similarities and differences between, some of these more common surgeries like hip or knee surgery and a C-section.
Right. So I think you've hit the nail on the head right there in that acute care is exceptionally important in all postoperative patients. And unfortunately, we don't seem to see very many physiotherapists in the like labor and delivery places and in the maternity wards. We just don't seem to have a foothold in those venues yet. And so I don't know what the reasons for that are. I don't know why you're more likely to get physiotherapy assistance after other gynecological surgeries or other abdominal thoracic surgeries. but there are some very simple techniques that all of us learn in postoperative care that can be applied to cesarean section and that aren't. And so I think that's something that us as a society need to examine, why we're not giving women access to those services.
And I think that just so people know, I mean, in the hospital, there is funding for physiotherapists to see people after, like you said, the hips and knees. And so you'll have that access. But I think that's why, and there just isn't, like you said, on the maternity wards, but that's why sometimes we promote, reach out and make a relationship with someone before you have your baby, because then even if it's not provided in the hospital, you know where to find us. And I think that's the benefit. I often tell people, just email me as soon as you have your baby. Here's a couple things I want you to think about. Email me as soon as you have your baby, and let's set up an online appointment so that we can walk through some things for you to do. We're going to talk specifically today about compression. And this isn't something I'm seeing used much at all in my community, but something when I do reach out with those people that have recently had a C-section, that's something I'm always bringing up as an option. So, can you talk a little bit about like just what I hate the term dumb it down, but I always ask for people to dumb that down. What is abdominal compression? Like, what does that even look like? What can people picture, and what would be the purpose of putting some compression after a C-section?
Right. So that's a great question, because I think more and more postpartum bracing and abdominal binders are making their way to social media and pop culture, and you have celebrities that are talking about it now. And so I think it's a good idea to know the difference between those types of products that are out there. But essentially what we're talking about is very similar to if you sprained an ankle and anyone had ever suggested that you put like an ACE tensor wrap on your ankle in order to help manage the swelling in that area. So there's theory that yes, you've had an abdominal incision and maybe we want to apply some compression. But I think it's even more than that when it comes to postpartum, because obviously the abdominal muscles go into a longer position. They get into a lengthened position. And so what happens when a baby's still in the abdominal muscle, behind the abdominal muscles, is that you've got force. So, when you speak, when you lift something, there's a baby in there that's helping to kind of build some pressure. And then when baby comes out, but the abdominal muscles are still just as long, it's hard to generate force. It's really hard to use a muscle when it's in like this stretched out position. And so we will hear patients say like, I have difficult time speaking, singing, even coughing after having a C-section or after pregnancy in general. And then add to that we've now had a procedure that has gone kind of through those muscles, and there can be incision related pain associated with C-section. So applying compression, like a gentle hug around that area, can benefit a number of different things that we see happen postpartum. And when I do say compression, I don't mean like the celebrity style waist trainers. This is not something that is incredibly restricted. This is something that's really quite stretchy. So that's more what we're talking about, is like a nice gentle compression into the abdominal area.
And I think what you're describing is that you're not trying to cinch it up. You're not trying to knit the muscles together, the tissues together. You're trying to help create that support that was there before.
Yeah.
Right.
Yeah. Sometimes I'll say to people, like, even like your athletic wear tights might be enough compression as long as they were to go high enough. Right.
And I think there's so many options out there. I mean, I think we all have some of our favorites that we might recommend, but there's so many options, which doesn't make certain ones right or wrong. But can you, there's everything from something that looks like it comes around you and Velcros at the front. There's options that are a little bit like a sleeve or like a belly band. There's some that come almost like with spandex or high-waisted leggings. I think sometimes people are looking for a black and white answer, like, should I use it or should I not? And obviously it's hard to kind of paint everybody with the same brush, but what do you, I guess I want you to tie in a little bit, like, what does the literature even say about this? And how is it gray? Why is this not black and white?
That was a lot of questions wrapped
I
into
know.
one.
Yes.
So maybe I will start with what the literature says, because at least from there we can say we've got some evidence to support the clinical decision making that we're making. So the evidence shows that an abdominal binder, and again, if you want to kind of picture something like an ACE tensor wrap that goes from just a little bit below your incision up to over where the uterus would still kind of be in postpartum. So as much as we'd like to think the uterus just like snaps back into place, it doesn't, right? So as long as it's covering the majority of the lower like abdomen, thoracic area, that's kind of what we're talking about, is that it can be beneficial to have that put on as soon as tolerated to help with pain management, okay? To help with function as far as being able to get up and walk, the number of times you could walk in a day, and probably the distance. For the physios listening, like their 6-minute walk test scores would be improved. It helps to lower distress scores in women postpartum. And so there's a sense of security that's described from women. I hear a lot of my cesarean patients say after surgery, it almost feels like my insides are falling out through my incision. And I think that can be an incredibly distressing sensation for someone who doesn't understand that well. And so having an abdominal binder kind of just pull you in and give support against that helps to decrease that distress that you can feel. And then one thing that's also worth talking about is the amount of opioids that would need to be used in the postoperative period and even at discharge. And we know that, the stat that's given in most of the cesarean research is that 1 in 300 moms who've delivered via C-section will become addicted to opioids within the year. We know that if we can reduce the amount of opioids required to help manage post-operative pain, that's much better at reducing those risks of addiction and long-term use of opioids. So those are kind of the big ones: pain, function, distress, and opioid use.
Which are big. And I think like I just want to point out that you didn't mention that it cures diastasis or that it strengthens your core or changes your abdominal appearance. And I think that's what a lot of people are kind of leading with. They're like, hey, Mel, can you please tell me, like, I'm hearing so much about this. Should I buy this or should I not? I'm hearing pros versus cons, but at the end of the day, that's not something the literature supports. But my guess is that generally with more comfort, more mobility, you're going to restore better muscle function eventually down the road. But just putting abdominal compression on is not enough to quote unquote fix your core.
Right. I think it's funny that that's like always one of the big discussion points is aesthetics, right? Like, how's my tummy going to look? From my perspective, my immediate concerns of someone coming out of a cesarean section is like, what are their risks of having blood clots? How do I get them up and functioning so they can actually take care of baby, bond with baby? How do I reduce their pain? And how do we make sure that they're, depending on non-drug related strategies to improve their recovery? The aesthetics is something, though, that is important and valuable to discuss because it is the priority of a lot of my patients. Mm-hmm. And that's where I find that there's this, we're not synchronized necessarily in the research and literature because we are coming at this topic from a medical background and looking at health outcomes and functional outcomes. But it is a valuable point is to mention that women, we do care about what we look like. Like, for good or for bad, this is the society that we live in, and we have certain expectations of how we should look, and we want to know answers to those questions as well. But as far as I know, there's not a significant amount of research to demonstrate that you're going to have an aesthetic improvement by using an abdominal binder after a postpartum period.
So what are you finding? I'm thinking of several clients that I've talked with, mostly online in those first few weeks when they reach out, and I always ask, how are you feeling? What are you having a hard time with? And inevitably you hear things like, oh, by the end of the day, I just feel really sore in my abdomen, not necessarily in my incision, but in my low abdomen, or I had to get up so many times last night because the baby was feeding a lot. And I can tell that getting up more often is giving me more discomfort. And that's one of the first things I think about. Are you wearing anything that gives some compression? Because I would love to see you have a little bit more support and less pain, but that's just not something that they're being recommended in the hospital. I'm curious to know what you're doing about that, because I see the benefit all the time. As soon as people get that on, they order it, they get it, and they think, oh my gosh, I wish I would have had this earlier. What are you doing about that?
Okay, so firstly, I really like the point that you raised about just we're not seeing the support from the hospital system in that. And I think until recently, there's been not enough research in women's health. With the opioid epidemic that we're having, there's been a lot more research put into trying to find non-drug related ways to manage pain. And so we actually do start to have when I started researching for the course that I teach in 2017, and I can tell you even within the last 5-6 years, the amount of research that has come out about abdominal binders post C-section has exploded. I used to be happy if I could have like 3 references to support my claims. I have an arm's length of studies to choose from at this point. And so we're starting to see a significant amount of research to the point where I'm also questioning, why aren't we examining this as a medical system? Why, like, now it's starting to get to the point where I think we've got serious argument as to why we're not offering binders. And in fact, you have there are different international anesthesiology societies that are now saying that TENS units and abdominal binders should be used postpartum for C-section patients in order to reduce the amount of pharmaceutical management that we're seeing. But I digress a little bit on that. What was the question? What was the second part of the question that you
Just
asked me about?
what are you, knowing that we don't give it in the hospital, what are you recommending?
Right. So just like you would expect to have a birth prep appointment with your patients who are expecting to deliver vaginally, we recommend strongly that even if you're having a planned cesarean section, that you give birth prep on C-section recovery. And so my patients that come in who know they're having a planned section, we do a full hour just on C-section prep. And in that hour is included what to do in the acute care phase, like in the first 2 weeks after birth or the first 4 weeks after birth. This is what I want to see you do. And for those that have vaginal deliveries, I give them a choice. I say, I know that your intent is to have a vaginal delivery. Would you mind if we discussed if a cesarean section happens, what my recommendations are? Some of them refuse because they're so focused on vaginal delivery, they don't want to learn anything about C-section, and some of them are very open to it. And so we may or may not kind of touch on that topic as well, even with a planned vaginal birth. One of the biggest clinical decisions that I make is that if someone is a second time mom and they know that they'll be having a C-section, so they already have a young one at home that they're tending to, and they're going to have a baby via belly birth, I strongly recommend that they get a binder, because it is very rare that mothers are able to follow the post-op recommended guidelines when you have to childcare. So all of those restrictions, like no housework for the first 2 weeks, no lifting more than the weight of baby for the first 6 to 8 weeks. It is very, very hard to follow those recommendations when you're, the primary caregiver to a small child, or if you're caregiving for another adult. And so we do have evidence that says that women who are put in the situation where they have to choose their health based on their surgeon's recommendations and caring for another human have really high distress with that. They feel like they're torn between trying to mom versus trying to take care of their own body. And so for them, I say, listen, if you are telling me obviously follow your surgeon's guidelines, please. But if you're telling me already right now that you're not going to follow them, then I recommend that you get a belly binder to help you with that.
And so do you have, and I don't know if you can say this on here, I'm putting you on the spot, but do you have certain options you recommend? Like, do you just say find one, or do you have a few that you recommend? Because there's so many different types. I'm happy to include that in the show notes, your thoughts, or I'm happy to just, if you feel like you have to say, I can't say that, then that's okay too.
No, I'm happy to say, because honestly, we haven't had a number of well-researched products. So as I said, like, this is a newer subject matter for us. Back when I started, the brand that we really have used a lot is the Belly Zinc brand. And that's because they're made in Canada. A physiotherapist was consulted in the development of that product. And so their ab wrap, I really like. I like it for a couple of other reasons as well, because it's made from like an ACE style tensor wrap, and it has almost like 4 arms of it. So women who are short waisted, me being one of them, like my ribs and my pelvic bones almost touch. I didn't fit into a lot of the other postpartum wraps because I just don't have a long enough torso. And so that one is so easy to adapt to different body sizes. And because it's not one that snaps or kind of clips into place, as your uterus involutes and like gets smaller and smaller, you need to be adding maybe a little bit more compression. And so that product is very adaptable to doing that. And so I'm a big supporter of their product, but I recognize that it comes at a cost. It's much more costly than some of the other things that you can find. And so the goal is that they feel like their abdomen is being given a hug, or it feels like it has support, that it doesn't feel so tight that it's restricting their breathing, and that it gives them kind of relief in those areas where they're seeking relief. So as I said, you could have someone that, you know, pre-baby, their exercise leggings give them that feeling. I'm fine with that. There are other products that are coming out every week. There are new products that are coming out. And so as I guess my biggest concern is that it's not too restrictive, because then we get into those waist trainers that we hear being talked about so much. And I don't find those to be helpful at all, mostly because they give too much support. So you don't learn to reuse your abdominal muscles the same way, I find. And there's some current concerns about how much pressure they apply on the pelvic floor when they're kind of zipped up and snapped up to full strength. So I think that, you know, we've got some good options out there, but I'm not saying that anyone has to stick to any one particular brand, but if you're looking for one that was really well designed and well thought out, I think that Belly Zinc offers a really good product.
What do you say about, do you generally recommend they check with their OBGYN before applying compression?
I'm really lucky locally to have a really good relationship with all the OBs here. And so when I get the recommendation for an abdominal wrap, I think that they know that it comes with a reason. And so I haven't had any resistance, but I think that would depend on your comfort level and how collaborative you work with local obstetricians. Obviously, it's always better to check than to not check, I think. But a lot of my patients don't even realize that they have issues until they've gotten home.
Mhm.
And so they might not have a easy time getting a hold of their OB. Sometimes more and more we're seeing like these 4 to 6 weeks postpartum assessments are getting pushed to 8 weeks to 12 weeks. Sometimes they're being done via phone. And so I find that I've been given a lot of license with what I feel is necessary from a rehabilitative standpoint. And I very much respect the advice that the physicians provide from a medical standpoint. So we try to work as collaboratively as possible. But I will tell you, most of the research, the binder's on day 1 and day 2 in hospital.
Mhm. Exactly. And so then obviously I imagine some people will have the question, well, does it matter if I have stitches, staples, or bandages? And I'm thinking your answer is it doesn't matter.
Yeah, so if you look at the research, it doesn't matter from a medical perspective. In fact, you have surgeons operating within the same hospital that will use
Mhm.
either of those methods. The biggest concern was if it's uncomfortable in the immediate postpartum time
Mhm.
frame, don't put it on. You don't have to wear it, right? So it's meant to help with pain management. It's meant to help with moving and getting up and trying to walk. But it doesn't need to go on immediately. I think me personally, I only started to wear one about a week. I started to wear one when I no longer had support at home. So when my husband had to go back to work and I had to take care of an infant, and then the second time when I had to take care of a toddler and an infant is when I used mine. And I had incredible amounts of low back pain when I had to do any sort of like standing at the kitchen counter or trying to get out to buy groceries. And so for me, it was a functional requirement that I had it on.
And yeah, I think that is kind of leads into my next question, which sounds like, because I can picture people would say, well, how much should I wear it and not wear it? And I generally say there's no real hard and fast rules. Like wear it when you want to, take it off, use it kind of trial and error. I actually used the Belly Zinc band too, and I found just based on the time of year, it was too hot to wear it all day. So I would learn to pick and choose when I wore it. But any further advice on that if someone's wondering how often should I wear it or how much should I wear it?
Right. So the protocols that are developed are all over the place. And to be honest, they're based on research that's being done in the hospital. And so when you run a research study, you have to make it the same for everyone. And then your patients are discharged after 2, 3 days. And so your research study can't last much longer than that. So you'll see anything from wearing it for all waking hours to 4 hours a day to only when up and active. And so I think you're absolutely right. At this point, it's just based on like clinically, you can make a good decision. And from your patient's perspective, like how you feel. So I found it most useful when I was up and doing things. And that's when I really used mine the most. The research has now extended in some of our studies to at least a week postpartum. And they still show really good improvements with pain and movement and function and distress at a week. But I felt like I wanted to use this thing for 3, 4 weeks, right? I do think it's important that we don't just put on a binder and forget it. Like, hey, put on this binder and like miraculously something would happen. I think you should still be in discussion with your physiotherapist on what you should be doing to train your pelvic floor during this time, on what you should be doing to try to re-engage your core muscles. But it's a tool. It's a tool like any other that are out there. I don't think you won't spontaneously combust if you don't have one on. But if you're looking for a little bit of support, then we know that there's very few side effects from using it. In fact, in all of the research that I've read, the only one side effect was one of the research participants had an allergic reaction to the elastin in one of the binders.
And I'm assuming then that again, advice for weaning it, because I think some people would have a hard time weaning it. And I think that, reach out to someone that can help you because like you mentioned, you're not going to spontaneously combust when you take it off. But if you feel like you can't, then work with someone maybe that can help you understand how your muscles work and how to feel, a little bit more uh, confidence with progressing your strength so that you don't feel like you need to rely on it for too long a period.
Yeah, absolutely. And I think that that begs the question, like, why are you wearing it? Are you wearing it because you feel like it's a lack of strength? Are you wearing it because of pain in the scar? Are you wearing it because of distress and anxiety? So there's lots of different things that should be explored with your medical team or your rehabilitative team. If you get to that point where you're feeling like it's very difficult to take the binder off.
What about, so again, the binder or the compression being a tool to help you feel a little bit more support and compression to the front of your abdomen, but not the only option. So do you have any other options, Katie, that you give to your clients? I think some of the movements that are most uncomfortable are getting out of bed, getting out of a deep chair. Any other suggestions that kind of help to provide a little bit more ease to that front area of the abdomen after C-section?
So you mean like aside from just the binder?
Yeah, aside from the binder.
Oh my gosh, there's a list as long as you can imagine. And there's actually some great studies out there right now. So this is where it would be so helpful to actually have a physio at bedside. But things like, you're right, so positioning. So you're speaking to the fact that, your abdominal muscles, I know that your next week you'll discuss this, but your abdominal muscles aren't cut through, but they do still have a surgery in that area. And so it is not comfortable when you activate them. So things like sitting up, rolling over, even when you lift your legs, you have to activate your abdominal muscles. Using the hospital beds button to like move you up is phenomenal. I've even heard of patients renting the bed when they got home so that they would have a movable bed for their own recovery at home. Some people will tie a scarf to the foot of their bed so they can pull themselves up, or a TheraBand or something like that, so they can pull themselves up using their arms. We recommend a lot of upper body strength training if you're going into a planned cesarean so that you can mobilize with your arms. Certainly things like not holding your breath to move. Abdominal splinting, if you talk to any physio who's ever done postoperative care, abdominal splinting is a trick we use all the time. And that's just if you take a pillow or a receiving blanket and you press it firmly but gently against an incision for any times where there'd be increased pressure in the abdomen. So upon standing, if you had to cough or sneeze, even for those first postpartum pees and poos, it's super useful for that as well. Ice, I mean, you talked about kind of compression, rest, ice, elevation. The elevation you want to be a little bit careful with because there are some blood pressure conditions that can discourage you from doing like a pelvic elevation. So I tend to stay away from elevation, but I do recommend ice pads. If you made padsicles because you thought you're going to have a vaginal delivery, they work over a C-section incision as well. There's a lot of research supporting the use of TENS units. So those are the little like electrodes that you might have had at physio before that feel like buzzing. That can go around the abdominal incision as well. And what am I forgetting? Chewing gum. Chewing gum is fantastic actually for bowel dysfunction after surgery. So chewing for 30 minutes a couple times a day can help with like that post operation bloaty gas pain that can extend up into the ribs and be uncomfortable. So like there's lots and lots and lots of suggestions. Absolutely.
Yeah. And I think this is all, like you said, this is all such good information that we can share with people before. And I think there's so much, I see it all the time. There's so much value in creating a relationship with a physiotherapist before, because then you just have a confidence with who you're going to reach out to. Sometimes you don't know you're going to have a C-section, or you don't know what it's like to feel what you feel after you've had your C-section. And so I think it's hard for people to reach out to a stranger at such a vulnerable time. And I think that a lot of this can be addressed before, and it's okay if you don't have it all memorized, but having that relationship to know who to reach out to. One other quick thing I think about when I picture people putting on this abdominal compression is that I think sometimes it would give people, like you said, there's a lot of nervousness just around, I have this, incision now in my lower abdomen, and how unstable is it, or what can I and can I not do? And so having that compression on isn't meant to immobilize your body, but more support it. And I think just as important to keep doing some of your breathing exercises, your pelvic floor exercises to reinstate movement and coordination. This isn't a tool meant to immobilize or stop you from moving. And so I love your point about making sure it's not too tight to still allow you to breathe and coordinate some of those muscles.
Yeah, it shouldn't feel restrictive to you to have on.
Yeah. Is there anything else, Katie, that you feel that I haven't asked you about that you think would be important to share in this
Oh,
episode?
I think that we've covered most of it. I guess one of the like sentiments that I have is that just because you didn't deliver vaginally, it doesn't mean that you aren't deserving of rehabilitative care. Because I do feel like there is this mentality behind C-section births that's like, it was the lesser birth, you took the easy way out, how could you have symptoms? You didn't even push anything out vaginally. And it's like, no, this is the only surgery that I can think of where you are handed another human immediately to take care of on the way, like as you're being wheeled out of the operating room. And so like my hat's off to C-section moms who have to recover from not only pregnancy and delivery, they have to recover from the surgery. And some of them have even tried to push a baby out for hours and hours before the surgery, right? And so we know that it is, there's no easy way to get a baby out. I don't care how the baby comes out, but you deserve to have proper rehabilitation. And I think that as practitioners, we need to step up because a lot of our education historically has been around vaginal deliveries and not about cesarean. And I think we're playing catch up with those moms at this point now.
Yeah, and I just wanted to kind of take the time. Actually, I've been introduced to a company that has an app funded by Health or supported by Health Canada, and it's called Stronger Together, and there's a community meant to support women preparing and recovering after C-section. So they're putting a lot of information in there, based on doulas providing information, labor and delivery nurse, breastfeeding support. So just a place where people do feel that there's information targeted to them. I'll make sure I put that in the show notes. And I also want to make sure that you share some of your offerings that you have to go in much more depth when it comes to C-section. So will you tell everybody listening what else they can find from you?
Right, sure. So if you are a practitioner, if you're a physiotherapist in Canada and you're a member of the Women's Health Division, there's actually a free webinar that's accessible for our CPA members on there. Otherwise, if you're looking to expand your education, I do have a pre-recorded course on Embodia that's 9 hours long. And then annually, I run a live online C-section course through Urosante. And that is actually coming up in June 2023. So there's still time to register for that if you like. I have a lot of fun teaching. I love doing that. And so you'll find a lot of free information on my Instagram account. So if you look me up on Facebook, Instagram, I've got a TikTok account as well, all under Katie Kelly PT, and our clinic socials as well under Reconnect Health. So we really try to take an approach of like a multidisciplinary treatment of C-section. So our massage therapists are trained in C-section scar massage. We've got a gynecologist on site that can give advice. We've got a chiropractor on site. All the pelvic floor PTs have their education in C-section. So I do teach a lot about scar massage, but I am not patient enough to do 30 minutes of scar massage. So I refer on to practitioners who are better at it than I am. So we do try to work very, very collaboratively. And I think that that is true even with the binder. You know what? I would never just prescribe a binder and say, that's it. Like, I'm going to teach you everything. I think that all of our tools work best when they're combined with our other clinical skills, and then when they're designed and tailored specifically for the human being sitting in front of us.
Yeah, and really, I mean, it sure sounds like you're talking about a knee brace. Like we would never just slap a knee brace on someone and say you're good. There's so it's an amazing tool for some people, but it's never going to be the be all and end all. And I think most people know that. And sometimes it's just hard to apply those same principles to some of the postpartum care, but they're very similar, aren't they?
Yep.
I look forward to having you another day on the podcast talking about some of your other areas of research, because I know you're a busy woman providing so much care and attention to this population and in the pelvic health world in general. So I can't thank you enough for everything that you do and for your time specifically today. I appreciate it.
Well, thank you. And the same sentiment is extended towards you as well.